Dear friends, according to your numerous requests, I'm answering the question about Lichen sclerosis, a kind of mystical disease which unfortunately occurs at any age, but especially in menopausal women. How serious is the diagnosis? How to diagnose it? I'm Dr. Olena Berezovska, and I'm greeting you on my YouTube channel. Prior to the classification in 1975 from the International Society for the Study of Vulvovaginal Disease, a society that studies vulvar and vaginal diseases, Lichen sclerosis was often referred to as leukoplakia, dystrophy, sclerosis, and these terms are not used today in modern medicine. I will explain why. You ask what were the mechanism of this condition or causes. In fact, there are several, and we divide them in four main groups. The first group is the genetic causes, and 4 genes have been identified that may be involved in the development of Lichen sclerosis. It has also been found that twins have this skin condition. The second group of mechanism is autoimmune, which is associated with autoimmune diseases. Quite often, first-line relatives have Lichen sclerosis. It is also most often associated with type 1 diabetes, autoimmune thyroiditis, psoriasis, and vitiligo. Another mechanism of development of Lichen sclerosis is infection. By the way, it is not just infection of the vulva or vagina, but infection such as the Lyme disease in the past, hepatitis C, and the presence of persistent HPV infection. And the fourth mechanism, which is more common among girls and young women of childbearing age, because now they remove hair from the intimate area, is a local mechanism due to skin damage, injuries, scars, burns. By the way, Lichen sclerosis of scars is called the Koebner phenomena. Did you know that Lichen sclerosis can be more than just genital problem? But there is also extragenital sclerosis when plaques occur outside the genital system. It occurs in 15–20% of cases. In 90% of cases of genital Lichen sclerosis, the anogenital area is damaged, the area of the anus or the area between the entrance to the vagina and the anus, and only 10% of other areas of skin are involved. In 20% of cases, this disease may be asymptomatic. This does not mean that this condition needs treatment if there is no symptoms. How does Lichen sclerosis manifest? Most often it's itching, almost 73% of cases, as well as pain of the vulva. Women complain of severe pain. In 43% of cases, there is pain during urination, dysuria. In 16% of cases, itching of the anus. Also, in menopausal women, Lichen sclerosis is associated with an increased risk of two skin conditions, vulvar neoplasia and keratinosis squamous cell carcinoma, vulvar cancer. How do we diagnose Lichen sclerosis? It's easy because in 90% of cases you can find a polygonal plaque on the skin. It's smooth, atrophic. The color resembles white porcelain, may even shine a little, or tissue paper. This may be a manifestation of Lichen sclerosis. A little later there is swelling. There are vascular manifestations, telangiectasia, purpura in 57%, rash, eroded skin in 73%, and there are cracks with hyperkeratosis in 52% of cases. Just what was once called sclerosis. The skin becomes rougher and the cracks appear. Lichen sclerosis never affects the vaginal mucosa. It can damage the skin at the entrance to the vagina, but most often it is outer part of the vulva. Interestingly, Lichen sclerosis can be found in girls, adult women, and menopausal women. But also, the histological picture of Lichen sclerosis will be the same for any age. What is Lichen sclerosis associated with? As I said, there are a number of autoimmune diseases, also systemic connective tissue diseases of the skin, for example, scleroderma. It can be systemic sclerosis, There is an association in women with autoimmune hypothyroidism and Hashimoto's thyroiditis, rheumatoid arthritis, psoriasis, type 1 diabetes, focal alopecia. We can observe lichen sclerosis in association with diseases of the urinary system, hyperactive bladder, stress urinary incontinence, also with irritable bowel syndrome, fibromyalgia, and temporomandibular joint. When we see women with such diseases, they have complaints of vulvar itching, or we see foci of skin damaged, we can suspect lichen sclerosis. Not so long ago, adults needed to go through the biopsy to diagnose lichen sclerosis. By the way, lichen sclerosis can affect not only women but also men. And in girls, it also happens in about one case for 900,000 girls. Currently, biopsies are performed very rarely because trauma of the damaged area of skin leads to worse consequences. It is believed that in the presence of a classic picture, we see plaque, there are complaints of itching and pain, histology is not recommended. But who do we do a biopsy? There are cases when a biopsy is needed, especially when the cancer or cancer changes are suspected, when the plaque is incurable. Various methods of treatment were tried, especially medication, and we did not get the desired results. Also, when the condition of the skin deteriorates, in the presence of extragenital skin lesions outside the vulva, and when there are pigment spots throughout melanoma. In such cases, we can and should perform a biopsy. When a biopsy is performed, what can be seen histologically? I will tell you frankly that I have counseled many women who have been diagnosed with this, as well as women whose daughters have been diagnosed with it. And it turned out that the description of the histology was too confused because doctors still use such non-existent diagnoses as vulvar sclerosis, leukoplakia, etc. Lichen sclerosis was described histologically in 1875 and was called ichthyositis. I remember that even in our textbooks there was this name. In 1885, more than 100 years ago, this condition began to be called vulvar sclerosis. But an accurate description of the histological picture of this condition was made in 1892, when atrophic changes in the epithelium of the skin were discovered, and this condition began to be called atrophic sclerosis, sclerosis atrophicus. And this term existed until 1975, when it was replaced by another one, Lichen sclerosus. Also, it is not herpes or sclerosing herpes, and not a fungal infection. Unfortunately, children also suffer from such skin disease. The term Lichen sclerosis was first used in pediatrics in 1901. As I said, the old terms are still used in a description of histology, and because of this we have inaccurate, false diagnosis. How to treat Lichen sclerosis? There are 4 groups of drugs. Quite often we use glucocorticoids or steroids topically. This treatment can also be used in children. Treatment is usually long and not always effective. The second group is a local immune modulators. This is a new direction. In children, mostly not used. Also, there are first attempts. We have slightly better results compared to steroids. All our retinoids, systemic forms of vitamin A, are used less frequently. Also, they may be effective in some women. And the fourth group is sex hormones, androgens and estrogens. This group of drugs is more commonly used during menopause, especially estrogen and testosterone. But the most important thing is that the treatment is always individual, because if there is an association with other diseases such as autoimmune or skin diseases, the treatment may not be effective. Therefore, we must select drugs individually and treat systemic diseases. Relapses occur and the effectiveness of treatment may depend on age. There were data that in children lichen sclerosis can outgrow. But in children, the cause of Lichen sclerosis is often because of injuries when the genital area is rubbed hard, for example with tight underwear, or when the mother tries to wash everything too much, or when the doctor prescribes unnecessary treatment and it dries the skin. It is also a trauma to the skin, especially young women who start shaving their hair, use a laser and get burns. Thus, if we do not remove the injury, we will not remove this local mechanism of permanent skin damage. As a result, we will eventually get Lichen sclerosis. That's why you need to be very careful with this part of your body. Very rarely we can use surgical treatment when we remove damaged areas of skin, but this does not guarantee that lesion plaques will not appear in other areas of the skin. If you like this video, please press like. Also, don't forget to subscribe to my channel. All the best. See you soon.